Hello everyone, welcome to my channel. I am Baisali Bharadwaj Dash, a student of 2nd MSc Food Science and Nutrition of Avinashlingam Institute for Home Science and Higher Education for Women. In this video, I'll talk about the nutrition and lifestyle changes that are essential during the pre-pregnancy phase of a woman. In this video, we'll see about introduction about why nutritional lifestyle changes are important during the pregnancy phase, what is preconceptional care, what are maternal underweight risks, what is the importance of healthy eating, what are nutrient-dense foods, physical activity routine, and why body weight and folic acid are important during pregnancy. Introduction. Research in recent decades has provided evidence that nutrition during pregnancy along with nutrition before pregnancy and early childhood has very strong programming effects on later function and health of both mother and child. Nutrition in pregnancy affects not only the growth of the child but also his brain growth and development, long-term cognitive function achievement, behavior and emotional achievements, immune function, risk of allergy and autoimmune diseases, bone health, and many other outcomes. In all this, of particular interest is the implication of early nutrition on later risk of obesity and associated disorders such as diabetes, cardiovascular diseases, disease risks such as heart attacks and stroke. So what is preconceptional care? This preconceptional care is defined as a set of interventions that aim to identify and modify biomedical, behavioral, and social risks to the woman's health or pregnancy outcome through prevention and management. There are certain steps that should be taken before conception or early in pregnancy to maximize health outcomes of both mother and child. This is a poster about preconception care, and good preconceptional health involves two things. Number one, planning pregnancy, that is educating women and their partners about when to start their families. B, preparing for pregnancy, and in this recognizing pre-pregnancy health behaviors and mitigating risks. Mitigating risks of genetic disorders and maternal and perinatal mortality. These all helps to reduce pregnancies that are too early, unplanned or too close. There is a term called pre-pregnancy prep which helps in making healthy choices before pregnancy. The P in PrEP stands for preparing for your pregnancy, like taking adequate contraceptions until you are ready for pregnancy, learning about hereditary genetic conditions and risks, etc. R stands for restricting use of harmful substances like pollutants, not taking drinks, and avoiding radiation, exposure to chemicals like lead and mercury, etc. E stands for ensuring a healthy lifestyle, like taking balanced diet with folic acid, iron and other nutrients, ensuring 150 minutes of exercise, and achieving optimal BMI of optimal body mass index. P stands for planning regular health checkups with your doctor, sharing detailed medical history, seeking counseling for mental health issues, and consulting your doctor for any advice. Next is the pre-pregnancy care checklist. First, genetic. It involves folic acid supplementation. Now, in our diet, we do consume folic acid, but apart from our dietary intake, extra 400 micrograms of folic acid should be taken. There should be carrier screening for racial, ethnic background, the family history of sickle cell anemia, cystic fibrosis, and thalassemia. In environmental toxins, smoking should be avoided. Alcoholism and use of illegal drugs should be avoided. The household chemicals like paint thinners, strippers, any kind of solvents, pesticides should be avoided. And any exposure to radiation during early pregnancy should be avoided. Screening for infectious diseases, treating and immunizing and counseling involving HIV, syphilis, gonorrhea and chlamydia, hepatitis C with women having tattoos or body piercings, taking immunizations for rubella, varicella and hepatitis B, and also influenza vaccine for women who get pregnant during the influenza season, and toxoplasmosis. Then medical assessment for overall health and opportunities of improving health of the pregnant women, and determining any kind of undiagnosed or uncontrolled medical problems like diabetes, hypertension, epilepsy, depression or anxiety, and other mental health issues. Lifestyle changes. Recommended regular moderate exercise, avoiding hypothermia, avoiding obesity and underweight, avoiding the risk of nutritional deficiencies. Now, though nutrients are very essential during pregnancy, the overuse of nutrients is strictly avoided. In case of vitamin A, there is a limit of 3000 IU per day. In case of vitamin D, limit to 400 IU per day, and in caffeine, limit to 2 cups of coffee or 6 glasses of soda per day. There should be screening for any kind of domestic violence in the woman's life, and they should be counseled on the use of over-the-counter medications, nutritional supplements, and naturopathic substances. Then, assessing any complications from previous pregnancies like cesarean section, premature delivery, hypertensive disorder of pregnancy, diabetes, RH incompatibility, postpartum hemorrhage, and thrombotic event. So that was all about the preconception care checklist. Now we'll see about certain maternal underweight risks. This term underweight, what does it mean? It refers to the body mass index less than 18.5 kg per meter square. If an underweight woman becomes pregnant, there are a high risk of delivery of a low birth weight infant, an infant with retarded fetal growth, and perinatal mortality. Pre-pregnancy underweight is also associated with a higher incidence of various pregnancy complications such as antepartum hemorrhage, premature rupture of membranes, anemia, and cesarean delivery. So why is healthy eating important? It is important to achieve healthy nutritional status, and pregnant women should especially follow a healthy eating pattern across their lifespan. Now, during pregnancy, healthy eating is important to meet increased nutritional demands, provide needed energy, prevent or minimize common pregnancy-related problems, reduce risk of birth defects, supply needed nutrients for the baby's growth, ensure healthy birth weight of the baby, and lastly, maintain the healthy weight of the mother. My pregnancy plate. What should a plate of a pregnant mother constitute? Firstly, it should constitute of non-starchy vegetables, a large portion of a variety of non-starchy vegetables such as green leafy vegetables, broccoli, carrots, peppers, or cabbage. Next, there should be fruits. They can choose from a variety of whole fruits. Juices and dry fruits should be limited. Fruits can serve as a great snack and dessert too. Next, there should be protein like poultry, beans, nuts, low mercury seafoods, eggs, tofu, or low fat cheese. Red meat and processed meat should be limited. Next, there should be whole grains such as whole wheat, bread or pasta, brown rice, quinoa, or oats, and other healthy starches like beans, lentils, sweet potatoes, etc. White bread, white rice, and fried potatoes should be limited. Apart from this, a small amount of healthy oils can be added, like olive oil and canola, for cooking or flavoring foods. Nuts, seeds, and avocados contain healthy fats, so they can also be added. The pregnant women should aim for at least 30 minutes of walking or any other type of physical activity each day. 2 to 3 servings of no fat or 1% milk or yogurt like cow, soy milk, or almond milk should be added. Apart from all this, drinking mainly water, decaf tea, or decaf coffee should be included, and sugary beverages should be strictly avoided. Nutrient dense foods. Nutrient density. The term nutrient density describes the ratio of nutrients present in a food relative to its energy content. These foods contain vitamins, minerals, complex carbohydrates, lean protein, and healthy fats. Examples of these foods are mainly whole grains, fruits and vegetables, low-fat and fat-free milk products, seafood, lean meats, eggs, peas, beans, and nuts. Now, choosing and consuming nutrient-dense foods ensures that the mother and the growing baby are getting the nutrients they need. The 15 most nutrient-dense foods on earth are grass-fed liver, shellfish, salmon, eggs, kale, seaweed, cocoa, avocado, sardines, should take mushrooms, spinach, almonds, grass-fed beef, bok choy, and tomatoes. Next, we'll see about physical activity routine. Women belonging to the reproductive age group should establish a physical activity routine. They should accumulate 150 minutes of moderate physical activity each week. It should be encouraged every day, but at least a minimum of 3 days per week should be included. Pregnant women should also include pelvic-related exercises daily. A variety of physical activities can be done like yoga, aerobic, and gentle stretching. Now, this physical activity program should be individualized, that is, for each woman, it should be based on her situation, experience, and her current health status. So, what are the benefits of exercising during pregnancy? It controls maternal weight gain, improved maternal well-being and body image, reduced risk of gestational diabetes, reduced risk of preeclampsia, reduced risk of gestational hypertension, reduced pelvic and lower back pain, reduced risk of acute cesarean section, reduced risk of prolonged labor and instrumental delivery, reduced risk of macrosomia, and reduced risk of preterm delivery. Next, we'll see about the importance of having a healthy body weight. An unhealthy body weight or unhealthy BMI during pregnancy can put both the mother and the child at a risk of increased complications, which can lead to morbidity and mortality and can also have severe long-term consequences. Now, this image shows how much weight should a pregnant woman gain when she becomes pregnant. It depends on the BMI or the pre-pregnancy BMI. Now, this BMI, how to calculate BMI? BMI is equal to weight in kgs divided by height in meters squares. Now, if a normal woman is underweight, that is, she has BMI less than 18.5, then she should gain at least 12.5 to 18 kgs during pregnancy. If a woman has normal weight, that is BMI between 18.5 to 24.9, then she should gain 11.5 to 16 kgs during pregnancy. If a woman is overweight with a BMI of 25 to 29.9, then she should gain 7 to 11 kgs during pregnancy. And if a woman is obese with BMI greater than equal to 30, then she should gain at most 5 to 9 kgs during pregnancy. It has also been proven that most of the adverse outcomes of obesity in pregnancy show strong association with the pre-pregnancy BMI. Therefore, all women belonging to the reproductive age group should aim at achieving a healthy BMI, that is 18.5 to 24.9 kg per meter square. Next, we'll see about folic acid. Folic acid is a very essential nutrient in pregnancy. It is vitamin B9, which naturally occurs in the form of folates in green leafy vegetables, legumes, whole grains, oranges, and pulses. Folic acid helps in production of red blood cells, helps baby's neural tube develop into brain and spinal cord. It is a source for DNA creation. It helps prevent miscarriage and preterm births. It helps prevent neural tube defects and low birth weight. Folic acid has benefits for both mother and baby. We'll see one by one. First, benefits to the baby. It helps in proper closing of the neural tube. It helps in creation, repair, and functioning of our genetic map, that is DNA. Aids in the formation of red blood cells, essential for rapid cell growth of placenta. It helps in the formation of fetal heart and circulatory system. It lowers baby's risk of getting birth defects like cleft lip and cleft palate. Few researchers also suggest that it prevents autism and congenital heart defects in the baby. In case of mother, it helps in preventing gestational diabetes and preterm labor. It helps the mother in maintaining an optimal level of hemoglobin and RBCs, thus preventing anemia. It also prevents complications like preeclampsia. These are the references that I have used in making the PPT and this video. Thank you everyone for your patient listening. If you like the video, do like, share and subscribe to my channel.